Um, there you go. Okay. Well, welcome everybody to NKA New Knowledge Adventures class of complementary and alternative healthcare. We're excited to have Michelle Anderson here, and I'll go ahead and hand it over to her in a minute here. I just wanted to talk about AARP and the New Knowledge Adventure classes just for a minute. New Knowledge Adventures it's all a volunteer program. I'm a volunteer. The instructors are volunteers. If anybody has an idea of, where there could be another class presented, or you want to be a volunteer, just let us know. We can give you the contact information on this. NKA was established in the Treasure Valley in 2015. It was modeled out of a successful program in Pocatello earlier. And we're just happy to be able to give these classes free to, to seniors who otherwise might not be able to get this information, and trust me, it is worthwhile information, a lot of it. So we will, if everybody can put themselves on mute, we will be taking questions towards the end of the presentation. And I was going to tell you what other classes there are this week, but it looks like I don't think there is any classes this rest of this week. But next week we're jam-packed with classes. So get on the CVent site for NKA 2022, and we're still, accepting signups for the classes. So with that, welcome, Michelle. And I know I'm very excited to hear your presentation. And I'm sure there's a whole lot of other people that are too. So thank you.
Thank you so much, Lisa and Shana, for having me, and for New Knowledge Adventures for providing this opportunity to share this types of information. My name is Michelle Anderson. I am a family nurse practitioner and have been for almost 22 years now. I've worked in acute care, cardiology, as well as family practice, and currently am the provider at ISU Meridian Healthcare, as well as working in a part-time basis in behavioral health at the VA system. I have education as a master's of family nurse practitioner from Duke University, and I received my doctorate from Idaho State University, which is where I also teach as a clinical assistant professor. So thank you for coming and showing interest in complementary and alternative healthcare. And during this class, we're going to look at common choices in this modality for common health ailments. Kind of like, have you ever wondered about acupuncture? Does that seem like it's a good choice for you? Have you wondered what it is that it does and how it might be able to help you? What about herbal therapies? Those are pretty common. We're going to talk about both complementary and alternative choices, including how they work with or in place of conventional medicine to help you better understand some of your healthcare options. We will be focusing pretty heavy on evidence-based choices. Our objectives today, so we're going to talk about the difference between complementary and alternative healthcare. They are sometimes used interchangeably, but they are not identical. We're going to define integrative healthcare, and then we're going to talk about different types of both complementary as well as alternative healthcare.
Good. How are you doing? I'm okay. You're enjoying the spring? Are you getting out in it a little?
I think Gypsy's phone is not on mute. There we go. Definitions. So let's start with a couple definitions, and then we'll break it down into some examples. So starting with complementary healthcare, if a non-mainstream approach is used together with conventional medicine, it's considered complementary, meaning you're putting two things together and they're going to complement each other in the outcome. And ideas for that are sometimes supplements and natural products, yoga and Tai Chi, chiropractic care, acupuncture, and I've got a list there of other options. And we'll talk about those and dive deep into them a little bit later in the presentation. We also have alternative healthcare. So if a non-mainstream approach is used in place of conventional medicine, it's considered alternative. So you'll see in this list that these will sometimes overlap and also be complementary. But often if people go to see a naturopath, they will go to see that naturopath and they'll see them for the majority of their medicine in place of more conventional medicine. So that's where the alternative part comes in. With alternative healthcare, often the remedies have not been shown through scientific studies. Either they're difficult to capture in a scientific study, or they can't show the end result that would make it statistically significant in a scientific study. And those are naturopathy, aromatherapy, herbology, homeopathy, Ayurveda, reflexology, and Reiki. So we're going to talk about quite a few different things that way. And just looking at complementary healthcare, there was a study done for the National Center for Health Statistics in 2015 that showed that approximately 18% of people will use a natural product or a supplement. Almost 11% will use some sort of deep breathing. Yoga and Tai Chi are often used 10% of the time, and these are as complements to mainstream. So it's relevant to talk about because it's definitely out there. So we have a third definition when we're talking about other options in healthcare, and that's integrative healthcare. This is healthcare that coordinates non-mainstream elements and mainstream elements to provide a more holistic treatment. And I'll break these examples down, but you can see how some of these all overlap, and that's what these examples will show. The whole practice itself goes by CAM, which stands for complementary and alternative medicine. So if we look at fertility treatment, this is often led in mainstream healthcare by endocrine specialists. They specialize in fertility. And with that, there's lots of different modalities and mainstream care, but often it involves hormone therapy, in vitro and such. However, when that is combined with acupuncture, which is considered more of a complementary option, it will further enhance fertility. Mental health care is another great example. You can take traditional mainstream medication management for anxiety, so pharmaceuticals and sometimes non-pharmaceuticals, and then you combine it with meditation. That's integrating care for a holistic approach. Hypertension is probably a really relevant example because as we age, we tend to have more incidence of high blood pressure. And this is where you would take your typical blood pressure medications and you combine it with special diets and special activities such as yoga. And as I break down the deep breathing slide a little bit later, it will also talk about how that can bring down blood pressure. So that's integrating care for a holistic approach. And back pain is probably one of the most common ones the average person will experience because there's not, when you're dealing with acute low back pain, there's some treatment modalities that do work in mainstream, but when you're dealing with chronic, it isn't always mainstream healthcare that can help. Sometimes it is medication management in the form of an anti-inflammatory drug like ibuprofen or Advil, Aleve. You may combine that with physical therapy, which is considered mainstream, but then you bring in more complementary care options such as massage and possibly chiropractic care. And those combinations sometimes are more effective when they're integrated together. So why do people choose this type of healthcare or this type of blend? In all fairness, Americans are willing to pay for these services. The mean per user out-of-pocket expenditure, meaning the amount of money used for these approaches, on average is $435 per person. And this was with family incomes less than $25,000. So that's a big chunk of change. And for people who have an income of $100,000 or more, it's about $590. If you look at just plain herbs that are available, 30,000 herbs are marketed currently. There's $30 to $40 billion spent annually. And if you look at visits to an alternative healthcare or a CAM provider, it's 600 million visits a year, which is significantly more than that to primary care providers per year. So people are looking for something that's natural or feels less invasive. They're looking for options for self-help, and this was even more relevant over the last couple of years with COVID when mainstream healthcare was not always available or accessible. People were looking for other approaches to address their health and wellness. There are some thoughts that it can be less expensive with fewer side effects. And if you are undergoing care with conventional options, symptoms are poorly controlled. And I talked about that on the last slide in regards to back pain a little bit. There's often dissatisfaction with the conventional healthcare provider. And then sometimes you're looking to treat the side effects from conventional care. And cancer care treatment is one option or one example of where you will sometimes look to more alternative or complementary things to help some of those side effects. So why do people not tell their healthcare provider? In average, about 38.3% of adults reported using some form of complementary therapy or health products, but they're not always telling their main primary care provider about this use. And sometimes it's because we just don't ask. We don't even think about it sometimes, so we're not asking that question. Sometimes the patient feels it's unimportant or not relevant for their provider to know about the alternative choices they're making. When I practiced up north, a lot of people just felt that their mainstream provider just would not understand, or they feared disapproval from that provider. And that's unfortunate, and it does exist, but it's one of the reasons people just don't share that information. So we're going to break out a little bit into complementary healthcare. So if you'll remember those two options we talked about, or those two definitions earlier, we're going to start with complementary, and this is where it accentuates or helps mainstream healthcare. We're going to talk with one of the biggest ones, the ones that I think are most significant, and that are natural products and supplements. I would warrant that everybody who's listening has tried a natural product or supplement at least once, if not multiple times, in multiple different kinds. And you can see on this slide all the different percentages of how they are being used and what they are looking like. So who takes supplements? 79% of adults over the age of 55 will take supplements. And of those who take them, 39% are using them for overall health and wellness benefits. I want to talk a little bit about healthcare issues that these have been shown to be helpful in regards to. And heart health is usually the number one. You can tell by the little omega-3 fish I have at the top there that it's one of the top reasons supplement users will take a supplement. 27% of males and 19% of females will take heart health supplements. And 30% of those users are over the age of 55. And there are benefits. This is actually one of those supplements. People often say that there's not a lot of research on supplements. It's getting a little bit better, but omega-3s are definitely one of them, just because of the significant amount of users of them. And I think it kind of works together. There's been more research, so you'll see more mainstream providers such as cardiologists and such recommending them. So you'll see the use go up with that also. But there are decades of credible nutrition science demonstrating the beneficial role of omega-3 fatty acids and what they do in reducing the risk of cardiovascular disease. There's definitely credible peer-reviewed researches, which is something that you really look at when you're looking at scientific backing of a supplement, that's demonstrated that these omega-3 fatty acids will reduce triglycerides and raise the good cholesterol, or the HDL, both of which are considered vital factors for maintaining a healthy heart. The U.S. Food and Drug Administration, in reviewing evidence and recognizing the public health benefit, authorized 2 qualified health claims. So when the FDA comes out and says, here are 2 qualified verifiable health claims, it's actually a pretty big deal when you're talking in the supplement world. The first came out in 2004, and that was that it supported the fact that this supplement will reduce the risk of coronary heart disease. And the second came out in 2019 for the reduction of blood pressure in the general population. Can't argue with either of those options. They have found that omega-3 fatty acids are important nutrients that are obtained by eating a fatty fish or taking the dietary supplements. And the dietary guidelines for Americans in general was to consume 8 or more ounces of seafood per week. Now, the average household does not do that. So unfortunately, for that reason, that is where the supplement would come into play. It's much easier sometimes to take the supplement than it is to try to get 8 ounces of that type of food item in your diet, or even have access to it in some settings. So when you consider taking the high safety profile of omega-3 fatty acid supplements, they're a very prudent choice to ensure that it is needed in your diet for the adequate nutritional value. We already know about cardiovascular disease, or I suspect most of us are familiar with it because it's talked about quite often in news articles, almost in magazines. You'll see it almost everywhere you go. But it's chronic and it's multifactorial. So if there's a way that supplements can play a risk in reducing this, I think there's some value there for sure. So that's the one I've talked about in regards to that. I'm going to talk about safety a little bit. I mean, we could go through, and we're going to go through a lot of herbs, but for supplements, that's one that has some really good backing. So the amount of scientific evidence on dietary supplements varies very widely. There's a lot of information on some and then incredibly little on others. So if you're considering using a dietary supplement, it's incredibly important to keep the following thoughts in mind. So sometimes the supplements you buy from stores or online may differ in important ways from the products that have been tested in research studies. So be aware of that. Not all omega-3 fish oils are created equal. Dietary supplements may interact with your medications, or they may pose risks if you have certain medical problems or are going to have surgery. There's many dietary supplements that have never been tested on pregnant women, nursing mothers, or children. So they're not necessarily transferable to all populations. And what's listed on the label of a dietary supplement may not be what's actually in the product. For example, there's many products that have been marketed for weight loss, sexual enhancement, bodybuilding, but they've been found to contain actual prescription drugs that are not allowed in dietary supplements, or other ingredients that are not even listed on the label. And some of these ingredients may be incredibly unsafe. And the rules for manufacturing and distributing dietary supplements are less strict than those for prescription or over-the-counter drugs. So although the FDA requires that companies submit safety data about any new ingredient not sold in the United States in a dietary supplement, the FDA is not actually authorized to review the supplements for safety and effectiveness before they're marketed. So those are incredibly important things to think about. On this next slide, I'm going to talk about herbal interactions, because these are some of the over-the-counter products a lot of people will use. And these are things to be really conscientious of in regards to medication interactions, such as what I talked about on the other slide. So low risk of drug interactions are listed here on the left. Black cohosh is often used in menopausal symptoms and different other modalities, and it may reduce the effectiveness of statins. Ginkgo has the potential to increase bleeding risk if a patient or consumer is using warfarin or Coumadin. Ginseng, which is often used to increase energy or boost alertness, it may reduce the INR. So once again, it may change the way you're treated for bleeding or the medications you're using for that. And it may modestly reduce blood glucose levels. So if you're thinking about a type 2 diabetic, and they're using ginseng and they're already on an a prescription medication that's lowering their glucose level, and you start using ginseng, this may lower it to a point where you have a super low level and have poor outcomes or poor side effects associated with that low level. So just be aware. And milk thistle is commonly used as a detox. It's used often in a liver detox, but for that same reason, because it's detoxing the liver, a lot of medications are also processed through the liver, and it can definitely decrease concentrations that are metabolized, such as the ones listed here. And I would say, when we talk about high risk of drug interactions, if you are on any sort of medication pharmaceutically from a healthcare provider, I would not use either one of these two. These can be used in settings where you're not on anything else and you're just using them for the nature of what they're entitled. But when you're putting them in combination with anything else, there is a high risk of drug interaction, and they're strong. And these would be two that if you're thinking about starting, you would definitely want to talk about with your mainstream healthcare provider because of the risk that goes with that. So I would strongly recommend to avoid the combination with most over-the-counter and prescription medications, as I said. And then St. John's wort can reduce the effectiveness of all the medications listed here. So if anything, avoid those if you're taking any other medicines, and then talk about them with your healthcare provider. So we're going to move on to one complementary healthcare option that a lot of people will use. Chiropractic care it's done by a licensed healthcare profession. It emphasizes body's ability to heal itself, and it typically involves manual therapy, including spinal manipulation, although there are different modalities that chiropractors are trained in and will use. They will also sometimes specialize in exercise and nutritional counseling. So they have a lot, and sometimes they're considered an alternative care provider because of all of the care that they'll sometimes provide to a patient or a family. They approach patient care in a manner similar to that of conventional medicine. They interview the patient, they obtain a detailed health history, they'll perform an examination, they'll often do tests and develop a working diagnosis, and then they move on to develop a management plan. They'll start treatment and monitor the patient's progress. They often treat problems related to the musculoskeletal system, but as I mentioned, they also can do nutrition and dietary counseling. The manual treatment methods that they use will range from stretching and sustained pressure to specific joint manipulations, which are usually delivered by hands and involve a quick and gentle thrust. And whoever's been to a chiropractor would know what that feels like. The purpose of the manipulation is to improve joint motion and function, and they're commonly done on the spine, but there are some chiropractors who work on extremities and such. Now, I think what most people don't understand about chiropractors is their education and licensure. In order to practice in the United States, chiropractors must earn a Doctor of Chiropractic degree. They have to pass a national board exam. They have to have a state license. And many states also require chiropractors to pass an exam about state-specific laws. And every state in the US requires a chiropractor to take continuing education classes. And in order to become a chiropractor, they have to enroll in a program that's in the United States. It usually takes about 4 years to complete. And prior to that, they've had to have 3 years of undergraduate education. So by the time they're practicing in an office, they're usually 7 years into an educational field. So they're not just somebody hanging a shingle on the wall. They do have a lot of rigor behind what they do. They're an accredited institution. They're recognized by the U.S. Secretary of Education. And their classes, usually involve anatomy and physiology, the basic sciences. They have supervised clinical experiences, just like other healthcare providers do. And they specialize in spinal assessment and adjustment techniques and making diagnoses. And then they'll sometimes go on after that to further specialize in orthopedics or pediatrics. And the scope of their practice varies from state to state, and they can be covered by health insurance. Sometimes they are, sometimes they're not, sometimes it's partial, it varies. So they're one of the most frequently utilized types of complementary and alternative care. The most common reason for an older adult to see a chiropractor is for musculoskeletal pain, and most commonly for lower back pain. Newer studies suggest that older adults' access to chiropractic care may reduce actual medical spending on services for spine conditions. And they have found that chiropractic care, including manipulation, can improve migraines and cervicogenic headaches. So there's definitely some science behind what they do. So we're always going to end all of these with talking about safety. So all recent studies report lower adverse effects in the older adult as being lower than previously reported in literature, even taking into account comorbidities such as osteoporosis. So you always hear about, will they hurt me? Are they going to break a rib? And I mean, that can happen. That is known to happen. It has happened, but it is lower than previously expected when they actually did research looking at that. It's actually felt that there may be even a lower incidence of adverse effects associated with spinal manipulative therapy in older adults due to the fact that most chiropractors will lighten their threshold of their thrust when they're using it, the amount of force they put into their maneuvers to minimize the force applied to a joint. So has benefits for sure and has safety concerns to watch for, but it seems that in general, the adverse effects are less than what they previously thought they would be. And there are definitely some complementary benefit to their care. We're going to move on to massage because goodness, who does not like it? Well, maybe there are people who don't like a massage. I'm not one of them. I think a massage is awesome. So it's usually used to help manage a health condition or enhance wellness. It involves manipulation of the soft tissue of the body. And it's been practiced in most cultures, both Eastern and Western, throughout human history. And it was absolutely one of the earliest tools that people used to try to relieve pain. So it's been studied for several types of pain, including low back pain, neck and shoulder pain, and pain from osteoarthritis of the knee, as well as headaches. And here's what the science is telling us. There's been several evaluations of massage for low back pain, and they have found only weak evidence that it may be helpful. And as hard as that is to hear, that is what the science has said so far. I don't think a massage is ever a negative thing, but for true therapeutic benefit, it has been weakly helpful. When they looked at clinical practice guidelines, which are things that healthcare providers will follow when managing certain conditions, and this was issued by the American College of Physicians in 2017, and they were looking at massage therapy as an option for treating acute and subacute low back pain. They did find some improvement and benefit, but not when looking at chronic back pain. It may be helpful for neck or shoulder pain, but the benefits may only last for a short time. And in 2016, a review of 4 studies looking at just over 500 people found that massage could provide short-term relief of neck pain if massage sessions were long enough and frequent enough. When you're looking at osteoarthritis of the knee, there's only a small amount of research. And once again, the suggestion is of short-term benefits in relieving knee pain. Of the studies they looked at, 5 provided short-term pain relief, 2 showed pain relief that involved essential oils in addition to the massage therapy. So there's some research and study out there. And then when you look at headaches, once again, only a small handful of studies, which is what makes complementary and alternative healthcare so difficult to make in recommendations, is due to minimalized studies. So they found that different types of massage and different types of headaches, there was no consistency between the type of massage and the type of headache, so that they couldn't really get good end data on it. And the participant size is usually pretty low. So in 2016, 64 participants used 2 types of massage. One was lymphatic drainage and one was traditional massage. And then they had a massage once a week for 8 weeks, which I think just sounds dreamy. Not the migraine part, because these are patients with migraines. And then they had people on a wait list. And when they compared the wait list people to the groups of people who had the lymphatic drainage massage or the traditional massage, the massage group always had better outcomes and felt better than the people who were on the waiting list. And that was somewhat reproduced with 56 people when they did the same thing with people with tension headaches. So when it comes to safety, the risks of harmful effects are pretty low. You know, there's obviously somebody who goes too hard or gives you a little bit of muscle or tissue pain following if you've had a deep tissue massage. But for the most part, the risk of harmful effects is low. So acupuncture, this is one of the questions I asked at the beginning. Have you ever thought about acupuncture? So it is a technique which practitioners use to stimulate specific points on the body. And it is one of the practices used in traditional Chinese medicine. And there's been extensive studies used on acupuncture. So that's kind of the neat part about this one. So what does science say about it? The results from a number of studies suggest that acupuncture may help ease types of pain that are often chronic, such as low back pain, neck pain, and osteoarthritis or knee pain. It also may help reduce the frequency of tension headaches and prevent migraine headaches. And therefore, it appears to be a reasonable option for people with chronic pain to consider. So there's definitely some value there. However, clinical practice guidelines are inconsistent in recommendations about it, meaning that the guidelines that are put out to help treat certain chronic issues, they're inconsistent in the recommendation. And it may be when you look at the effects of acupuncture on the brain and body and how best to measure them, they're only beginning to be understood. Current evidence suggests that many factors like expectation and belief that are unrelated to acupuncture needling specifically may play an important role in the beneficial effects of acupuncture on pain. So an interesting note and point is that the VA system offers battlefield acupuncture. This is acupuncture that's done on 5 spots on an ear. And because its ears are typically easily accessible, they can be done literally in the battlefield. And we know that a lot of our veterans experience chronic pain. It's a really serious problem for them. So in 2001, this form of acupuncture was developed, and I've actually, working at the VA, have become certified in this modality. And it does reduce pain for those with headaches, acute and chronic back and musculoskeletal pain, and neuropathic pain. So there is some proven benefit there, and it is something that is available through the VA system. You can ask any veterans who are listening to this, can ask for that should they have an interest in having it done and deal with any of the chronic pains I mentioned. So further, what does science say about the safety and side effects of acupuncture? It's generally safe, especially if it's performed by an experienced and well-trained practitioner using sterile needles. So relatively few complications usually arise from it. If it's not delivered properly, acupuncture can cause serious adverse effects, including infections, hence non-sterile needles likely, punctured organs, collapsed lungs, and injury to the central nervous system. Now, I myself have had acupuncture in my life several times, and those needles are like hair length. They're very, very small. You don't even often feel them going in. And in order for them to cause this type of damage, you would have to have somebody who was completely untrained in what they were doing, because that's just almost impossible. It is just scratching the surface of the skin for where they go in. So it'd be incredibly rare for this to happen, but it does need to be mentioned. So that being said, if you decide to visit an acupuncturist, make sure to check his or her credentials. So for acupuncturists, most states require a license, a certification, or registration to practice. Education and training standards and requirements for obtaining these vary from state to state. And although a license does not ensure quality of care, it does indicate that the practitioner meets certain standards regarding the knowledge and use of acupuncture. And most states will require a diploma from the National Certification Commission for Acupuncture and Oriental Medicine for licensing. Idaho is pretty strict on it. They have strong requirements in order to practice it. So it's usually pretty well received here in regards to the licensing and the rigor. I'm going to move on to deep breathing, and I call this more or less deep breathing and more relaxation techniques, because that's what we're really talking about here. And what happens with relaxation techniques is that it brings the body's relaxation, brings the body a relaxation response, which is actually completely the opposite of a stress response. And there's different ways of doing that, and I've got some of those listed here, and we'll walk our way through some of that. So progressive relaxation, it's also called progressive muscle relaxation. And this is a technique that involves tensing different muscles in your body and then releasing that tension. Autogenic training, this is where you go through a series of mental exercises involving relaxation and ideas you suggest to yourself. So kind of auto-suggestion, hence the autogenic. Your mind focuses on your body's experience of relaxation. There's guided imagery. I think we've all heard about this at some point in time. This has been incredibly common in childbirth, where they have a guided image or visualization when you're in an uncomfortable spot. You picture an object, a scene, or an event that is associated with relaxation or calmness, and you attempt to produce that similar response in your body. Biofeedback is becoming a more common term that we're hearing nowadays. This is through feedback that's usually provided by an electronic device. You learn how to recognize and manage how your body responds. The electronic device lets you see how your heart rate, blood pressure, or muscle tension changes in response to how it's feeling, if it's stressed or relaxed. There's some self-hypnosis out there where you can prompt a suggested word of your own that allows you to go into relaxation response. And then the breathing exercises. And this is where you focus on taking slow and deep breath. And this is also known as diaphragmatic breathing. So the question they ask is, can relaxation techniques lower blood pressure? The answer is actually yes, it can. A study in 2019 looked at 17 previous studies done involving almost 1,200 participants, so a pretty good rigorous study, that indicated that slow breathing exercises led to a modest reduction in blood pressure and may be a reasonable first treatment for people with pre-hypertension or low risk high blood pressure. So there is some true value to this, and it has been shown through science. And from a safety standpoint, relaxation techniques are generally considered safe for healthy people. And in most research studies, there's been no reported negative side effects. We all breathe ideally, so hence deeper breathing shouldn't change that. So let's talk about meditation. It has a long history of use for increasing calmness and physical relaxation. It improves psychological balance, coping with illness, and enhancing overall health and well-being. And a report released in 2017 from the National Health Interview Survey found that US adults use meditation. The use of meditation from the years between 2012 and 2017 essentially tripled. Now, I would challenge, we don't have this current data, this is the most recent data I could find, on what meditation did from 2019 to 2022. I wonder if spending more time at home and all the stress involved over the last couple of years, if that increased even further. It would be an interesting study to know. So there's many types of meditation, but most of them have 4 elements in common. This involves a quiet location with as few distractions as possible, a very specific, comfortable position, and this could be sitting or lying down, walking, or just any other position. And then a focus of attention, and then an open attitude, so letting distractions come and go naturally without judging them. There are definitely benefits to meditation, and there's evidence that it may reduce blood pressure as well as symptoms of irritable bowel syndrome and flare-ups in people who have ulcerative colitis. It may also ease symptoms of anxiety and depression and may help people with insomnia. So when looking at safety, it's generally considered to be safe for healthy people. People with physical limitations may not be able to participate in certain meditative practices that involve movement. And then there have been rare reports where meditation could cause or worsen symptoms in patients with certain psychiatric problems such as anxiety and depression. And so anytime you're thinking about this and you fall into either of those last 2 categories, to check with your healthcare provider. We've all heard yoga and Tai Chi. I have practiced yoga. I have not practiced Tai Chi. So yoga is an ancient and complex practice. It's rooted in Indian philosophy. It began as a spiritual practice, but has become popular as a way of promoting physical and mental well-being. And there are definitely health benefits. Research suggests that yoga may improve general wellness by relieving stress, supporting good habits, and improving mental and emotional health, sleep, and balance. It's been known to relieve low back pain and neck pain, and possibly pain from tension-type headaches and knee osteoarthritis. For people who are overweight or obese, it may help them lose weight. It has helped people quit smoking. It has helped people manage anxiety or depressive symptoms associated with difficult life situations. And it's been known to relieve menopause symptoms. So it's all some pretty good benefits. So Tai Chi is a practice that involves a series of slow, gentle movements and physical postures. You kind of are in a meditative state of mind with some controlled breathing. It originated as an ancient martial art in China, and over the years, it has become more focused on health promotion and rehabilitation. So it too has benefits. It may be beneficial in improving balance and preventing falls in older adults and people with Parkinson's disease. And when looking at dementia, there are some short-term benefits in the overall cognition of people with mild cognitive impairment. And it was found that it was similar to other types of exercise in regards to that improvement. The results of the study suggested that if it's done 3 times a week for 30 to 60 minutes per session for at least 3 months, that it had a positive impact on some cognitive functions. So once again, some benefit. And then we looked at quality of life. A study done in 2020 looked at 13 previous studies with almost 900 participants, and they found a small positive effect on the quality of life and depressive symptoms of older adults with chronic conditions, especially those who lived in community settings. There was no significant effect seen for mobility or physical endurance in that study or that review. And since essentially it's generally safe when it's done with a qualified instructor in a safe form, and that's the most important part. If you're not using the correct form, you definitely can hurt yourself. So you have to be in a safe setting and be with a qualified instructor who can point out if your form is off for this. And injuries can occur as with any physical activity, and the most common ones reported were sprains and strains, and the injuries are higher in adults who are over the age of 65. So we're going to switch gears here and move on to alternative healthcare. So we were talking about complementary, meaning ones that work with conventional healthcare. We're going to move into areas where sometimes it's used in place of conventional healthcare. And although you'll hear a lot of things that can be used together, I talk about it as alternative because some people who seek this modality seek it in its entirety as opposed to using it as a complement. The general scientific consensus is that alternative therapies lack the requisite scientific validation, and their effectiveness is either unproved or disproved. Now, that being said, I have branched out into a lot of these modalities, and we'll give you some examples of what have been effective in my practice. So we're going to start with naturopathy. It's also called Naturopathic Medicine, and it's a medical system that has evolved from a combination of traditional practices and healthcare approaches popular in Europe during the 19th century. And often people will visit naturopathic practitioners for various health-related purposes, including primary care and overall well-being and treatment of illnesses. I put this under alternative healthcare as people who see naturopaths often see them exclusively for their healthcare. It can also, as I mentioned earlier, be blended into complementary healthcare, as many traditional healthcare providers will utilize some naturopathic tendencies. In the United States, naturopathy is practiced by naturopathic physicians, traditional naturopaths, and other healthcare providers, and who will also offer some of the service. And I would have fallen under that latter category as another healthcare provider who offered some of these options of care or suggestions of care. So what do naturopathic practitioners do? There's a long list of all the things that they will address when it comes to treatment approaches. And some examples include dietary and lifestyle changes, stress reduction, herbal and other dietary supplement recommendation, homeopathy, manipulative therapies, exercise therapies, practitioner-guided detoxification, which is most commonly what I heard from patients who saw naturopaths, psychotherapy and counseling. And some practitioners use other methods as well. And they will often, as practitioners, notice that if they are out of their scope or feel like there's more conventional care that needs to be done, will refer to the primary care health provider. Education and licensing of practitioners for a true naturopathic physician almost follows that of a chiropractor. They complete a 4-year graduate level program at one of North American naturopathic medical schools that is accredited and recognized by the U.S. Department of Education. Some U.S. states and territories have licensing requirements for naturopathic physicians, others do not. In those jurisdictions that do have licensing requirements, naturopathic physicians must graduate from a 4-year naturopathic medical college and pass an examination to receive a license, and they must fulfill annual continuing education requirements. This is where Idaho now falls into recently. It has not always been that way, but over the last few years, naturopathic physicians were able to finally get licensed, the ones out of this first category that I mentioned, and can now do some prescriptive medication also. So they have a far greater scope in Idaho now based on some recent legislative changes. Traditional naturopaths may simply be known as naturopaths. They receive training in a variety of ways, and the program length varies in length and content, and it's not accredited by organizations recognized by accrediting bodies, and they may not be eligible, and they're definitely not eligible in Idaho for licensing. And then the other healthcare providers, which is where I fall under, and this is physicians, osteopathic physicians, chiropractors, dentists, nurse practitioners. They will sometimes offer naturopathic treatments, functional medicine, and other holistic therapies, having pursued additional training in the areas, and those training programs also vary. So a recent system review done in 2019 found that naturopathic medicine is effective for treating cardiovascular disease, and I have it listed here: musculoskeletal pain, type 2 diabetes, polycystic ovarian syndrome, depression, anxiety, and a range of chronic complex conditions. So there is some basis for what, there's always basis for what anybody does, but there's some scientific proof and backing on what naturopaths do in those modalities. And when looking at safety, according to a report from California Naturopathic Doctors Association, since the licensure was granted in California in 2005, which was much earlier than that here in Idaho, nearly 500 practicing naturopathic doctors have a pristine safety record with no cases of patient harm. And that was dated as of 2017. So for the most part, although we may not always understand all that they do, their safety record is pretty consistently pristine. Herbology. Now, this is going to be an interesting one. On the next slide, I'm going to break down 10 of the most commonly used herbs that you'll see over the counter and that you yourself may be using or have experienced or heard about. But just looking at herbology itself, this is how the herbs are broken down. You can look at it as a tea, you can look at it as a decoction, you can look at it as a tincture, a powder, or an essential oil. I have seen probably all different variations of this, but the most commonly I see are teas, tinctures, and essential oils. And because there's very minimal studies on herbs, the data is not always available. So we'll break all this down a little bit, but it's tough because of bioavailability. So the common herbs used in healthcare, these are the ones I'm going to talk about. Aloe vera, and you can see the aloe vera plant right there. It's historically been used for skin conditions and was thought to improve baldness and promote wound healing. It's used topically and orally, topically meaning applied to the skin. The topical use is promoted for acne, oral submucous fibrosis, burning mouth syndrome, burns, and radiation-induced skin toxicity. I will tell you, aloe is incredibly helpful in those modalities, or for those modalities. The oral use of aloe is promoted for weight loss, diabetes, hepatitis, and inflammatory bowel disease. And I have often recommended aloe in my patients who are having GI upset because it does really seem to settle the stomach and really work well on anything that involves inflammation. I've also recommended aloe vera for burns, as we've always known it. Over the counter, you see it always added to burn cream, or there's aloe vera gel. Those green ones you see are typically not really the best choices. Finding something from a Whole Foods store that is a little more pure is usually a little more effective, but definitely has been around for a while, and most of us are comfortable with it. There's also aloe vera juice out there that is nicely used for people who are trying to rehydrate. So a lot of my flu patients or people who've had a lot of nausea and vomiting, they can usually tolerate sips of aloe vera juice quite successfully, and it really helps settle their stomach. Chamomile. Also, we're probably most familiar with this as a tea. I'm also familiar with this as a homeopathic tablet. It has been used on, I've used it on my children for teething. It was very effective. But it's promoted for sleeplessness, anxiety, and gastrointestinal conditions such as upset stomach, gas, or diarrhea. It can also be used topically for skin conditions and for mouth sores resulting from cancer treatment. So if you have a family member, a loved one, or a friend who's going through cancer treatment and is having mouth sores, the chamomile tea is sometimes a really nice option for that. That feels a little more natural for them compared to maybe all the other things they're experiencing. Echinacea has been promoted as a dietary supplement for the common cold and other infections. We're all familiar with taking a little bit of echinacea when we have a cold. It's based on the idea that it might stimulate the immune system to be more effective in fighting an infection. And the research on it shows that taking it might slightly reduce your chance of getting a cold, but if you have a cold already, it's probably not going to do too much. Just know that. So use it as a preventative. You're going to get ready to get on a plane and it's cold and flu season, maybe a couple of weeks ahead of time, be taking some echinacea to build up that immune system for prevention. But once you have it, it's not as effective. Echinacea preparations have been promoted for topical use for wounds and skin problems. And the most common side effect of echinacea are digestive tract symptoms such as nausea or stomach pain. That's what you'll typically hear. So elderberry is incredibly common up north. I'm not sure if it's as common here in the southern part of the state, but it was often used up there in gummies or syrups or different ways. And it's been promoted as a dietary supplement for colds, flus, and other conditions. There was also some at the beginning of COVID-19 where people talked about it as a promotion for treatment of COVID-19. But there has been no good evidence to support its use. Some preliminary research suggests that elderberry may relieve symptoms of flu or other respiratory infections. But so symptomatic relief it is. I don't know that it causes too many problems unless you take too much of it. But for the most part, it's pretty well tolerated, and kids seem to like the gummies. So green tea, we've all thought about green tea. We've heard about green tea whenever we're doing a cleansing diet or we're thinking about weight loss. Green tea definitely is part of the natural thought processes there. If you're looking at a more natural option for that, if you're trying to avoid caffeine, you could do decaffeinated green tea, but that's less common. So to produce green tea, leaves from the plant are steamed, they're pan fried, and then they're dried. The tea has been used for medicinal purposes in China and Japan for thousands of years. So if we're looking at an herbal that's been around a long, long time, green tea is definitely one of those. It has a beverage, it can be a beverage or a dietary supplement. It's been promoted for improving mental alertness, relieving digestive symptoms and headaches, and promoting weight loss, as I mentioned earlier. Green tea and its components has been studied for their possible effectiveness against heart disease and cancer. So it's looked there too. I don't have the results on that, but it is being looked at for that. And the FDA has approved a topical ointment called Verigen, which includes extracted components of green tea leaves and is used for the treatment of genital warts. So it's kind of made its way over into a little more mainstream care in that regard. Lavender, I mean, I always think of lavender as a scent. When I hear that word, I can smell it instantaneously. In ancient Rome, lavender was used as a bath additive. It's used to flavor foods and beverages and as a fragrant ingredient in soaps and cosmetics. It's been promoted as a dietary supplement for anxiety, depression, digestive symptoms, and other conditions. And it's also been promoted for topical use and use in aromatherapy. It is an essential oil. It is commonly used for relaxation. It's not a hot oil, it's a cool oil. So it usually doesn't cause any sort of burning effect if it's put anywhere on the skin, but always whenever you're using an essential oil, just try a small amount first to see how your body would respond to that. I most commonly know it in massage, where I'm laying down there and massage therapist offers that option of a scent while you're being massaged. Because I'm there to relax, the lavender helps me in that relaxation. And so that's often something that's applied there. And consumption of lavender in amounts typically used in foods is likely to be safe. It's not considered harmful. Saw palmetto, I think almost all of us have heard of that. Perhaps more of the men who are listening or watching versus the ladies, but it is used both ways. It's a shrub like palm native, and you can see the palm right there. It's used for a variety of conditions, including disorders of the male and female reproductive organs and coughs due to various diseases. Currently, it's being promoted as a dietary supplement for urinary symptoms associated with an enlarged prostate gland, as well as for chronic pelvic pain, migraine, hair loss, and other conditions. However, no product has been conclusively shown to be effective for benign prostatic hypertrophy. So just know that. We haven't been able to prove its effectiveness, even though it's promoted pretty strongly that way. Tea tree oil, you'll sometimes see this in shampoos and different things. It's also an oil, it's a hot oil. So when you put it on something, it can have a little bit of a burning sensation, so be aware of that. It comes from a steam distillation of the leaves of the tea tree. The tea tree grows on a swampy southeast coast of Australia. Today, the external use of tea tree oil is promoted for various conditions such as acne, athlete's foot, lice, nail fungus, cuts, a mite infection at the base of the eyelids, and insect bites. I have used it successfully in my primary care setting for pediatrics for molluscum contagiosum. It's a difficult little disorder that happens among kids that will last for months at a time, and can, if you've got lots of kids in the family, it'll move its way through the kids. I have found this pretty effective, putting a little bit on, but you have to be careful because, as I mentioned, it's a hot oil, so you want to be super careful and just try a little bit first and make sure that it's okay for that child or that person to use it. But that's been amazing. So nothing else mainstream as helpful as that. So turmeric, we've heard more and more about this. It's a plant of the ginger family. It's native to Southeast Asia and is grown commercially in that region, primarily in India. Historically, it was used in Ayurveda and other traditional Indian medical systems, as well as the Eastern Asian medical systems, such as traditional Chinese medicine. In India, it was traditionally used for disorders of the skin, the upper respiratory tract, joints, and digestive system. Today, it is promoted as a dietary supplement for a variety of conditions, including arthritis, digestive disorders, respiratory infections, allergies, liver disease, depression, and many more. And if you look at that list I just said, the most common thing there is inflammation. And turmeric is a nice, and curcumin, which is a component of it, is a nice anti-inflammatory. So there is some really nice benefit to it. Curcumin, which I just mentioned, is a major component of turmeric, and the activities of turmeric are commonly attributed to curcuminoids. It gives it its yellow color, and together they have a variety of interesting biological activities, but they're challenging to study because it's unstable. The curcumin part of it is very unstable, meaning it changes easily into other substances and has incredibly low bioavailability, meaning that not much of it is released into the bloodstream when it is taken orally. So it makes it difficult there. And the very last one of the 10 is valerian. It's a plant native to Europe and Asia. It also grows in North America. It's been used medicinally since the time of early Greece and Rome. Historically, it was used to treat insomnia, migraines, fatigue, and stomach cramps. Today, it's promoted for insomnia, anxiety, depression, premenstrual syndrome, menopause symptoms, and headaches. And the evidence on it is pretty inconsistent. And in 2017, the American Academy of Sleep Medicine and their 2017 clinical practice guidelines recommended against using it in chronic insomnia in adults. So maybe trying it in acute, but not as effective in chronic meaning that it's there all the time. So it might be something to try if you're having a short burst of sleep difficulty, but if it's chronic, it's probably not going to have any benefit, or it's not known scientifically to show that. Reflexology, you think about it, you think, oh, it's just your feet getting rubbed. Actually, it's not. There is some pretty significant background behind it. It's a practice in which different amounts of pressure are applied to specific points on the feet or the hands. They are believed to match up with certain other parts of the body, and it claims that it will cause relaxation in the healing process in parts of the body, but this has so far not been proven. So how does it work? There's a couple of theories on this. No one's exactly sure exactly how it works, but I'm going to review two of those theories. And the first one is the one that rests on ancient Chinese belief in qi, or vital energy. According to this belief, qi flows through each person. When a person feels stressed, their body blocks the qi. This can cause an imbalance in the body that leads to illness. And then the reflexology will aim to keep the qi flowing throughout the body, keeping the body balanced and disease-free. In Chinese medicine, different body parts are correspond with different pressure points. So you'll often see graphs of the foot and where it relates to, and this is the Chinese medicine graph. They believe their touch sends energy flowing through a person's body until it reaches the area in need of healing. Other theories, British scientists found that nerves connect the skin and internal organs. They also found that the body's entire nervous system tends to adjust to outside factors, including touch, and that a reflexologist's touch may help calm the central nervous system, promoting the relaxation and other benefits, just like any form of massage. So I'm going to talk about a little study here, and it's from the National Cancer Institute, and it was done with women with advanced breast cancer who received reflexology treatments, and it did show improvement in a few symptoms, such as shortness of breath, but did not help in others, such as nausea or pain. In this study, however, it was safe even in the most fragile patients. So when we're talking about safety, even in a setting of real fragile patients, it's been proven to be safe. So I would indicate that that is a safe use there for sure. Another study looked at it for a burning or prickling sensation associated with multiple sclerosis, but there was insufficient evidence to prove any benefit. Got a couple more here and then we are done. So Ayurveda is a system of traditional medicine native to India. It bases its theory on the existence of 5 elements, which I have listed here. And the techniques involved in it include dietary changes, herbal medicines, acupuncture, massage, meditation, breathing exercises, panchakarma, which are the 5 actions, sound therapy, and yoga. And so when you look at Ayurveda, you're probably looking at a practitioner, and people who are looking at this type of healthcare or this alternative healthcare are looking at this usually instead of conventional healthcare, hence why they have the ability, or they claim to have the ability to look at all those different elements. And then they utilize a lot of complementary and alternative care. So Ayurveda and modern medicine parallel in their approach found. The principle of wind operates communication and movement of the body. It deals with the nervous system, with the joints where the movement takes place, and with elimination of waste and so on. Its main seat is the colon. The pitta or fire relates to the metabolic processes in the body, and using the vocabulary of allopathic medicine, it is responsible for the endocrine system or hormones and the digestive system or enzymes. The main organs of Pitta are the small intestine, the liver, and duodenum, while the Kapha earth is related to the structure of the body, meaning the 7 bodily tissues, the bones, and the muscles. So although different in its presentation, it does correlate back to different body parts, and so their treatments relate to those same processes. And safety on this one is important to talk about because the US Food and Drug Administration warned that the presence of metals in some Ayurvedic products makes them potentially harmful. And some studies show that 40% had elevated blood levels of lead and some had elevated blood levels of mercury. So just be aware of that when you're looking at those types of products. Homeopathy, I used actually a lot of this in my primary care practice. It is a medical system based on the belief that the body can cure itself, and those who practice it use tiny amounts of natural substances like plants or minerals. So it is developed in Germany more than 200 years ago. And the 2 unconventional theories it's based on, and this was based from science, which calls it unconventional, is that like cures like, meaning the notion that a disease can be cured by a substance that produces similar symptoms in healthy people, and the law of minimum dose, or the notion that the lower the dose of the medication, the greater its effectiveness. So many homeopathic products are so diluted that no molecules of the original substance remain. They come from plants such as red onion, arnica, mountain herb, poison ivy, belladonna, which is considered a deadly nightshade, and stinging nettle, minerals such as white arsenic, or animals such as crushed whole bees. Homeopathic products are often made as sugar pellets to be placed under the tongue, but they also have other forms such as ointment, gels, drops, creams, and tablets. The treatments are individualized or tailored to each person, so you may have the same general condition, but each treatment may be completely different. And homeopathy uses a different diagnostic system for assigning treatments to individuals and recognizes clinical patterns of signs and symptoms that are different from those of conventional therapy. We'll talk a little bit about what science says. 2015 comprehensive assessment done by Australian government's National Health and Medical Research Council concluded there's no reliable evidence that homeopathy is effective for any health condition. However, it's important to note that studies included in the assessment had such high rigor that it was unlikely that studies in alternative or complementary care would have even met that rigor because it's just not possible. So that's important to know. And it is a controversial topic. A number of the key concepts underlying the theory of homeopathy are not consistent with fundamental scientific concepts as well as we understand them. For example, homeopathic preparations can be so dilute that a substance considered to be the active ingredient becomes unmeasurable, which creates incredible challenges to rigorous investigation of these products. Recent research has begun to examine physical attributes of these preparations to determine if it will be possible to characterize them in the future. And people and practitioners who utilize homeopathic products use them to treat conditions such as allergies, migraines, depression, chronic fatigue syndrome, rheumatoid arthritis, irritable bowel syndrome, and premenstrual symptoms. I've additionally seen it used for teething and colic as well as anxiety and sleep. Now, arnica is considered a homeopathic remedy, and I've seen it used as a tablet as well as a gel. And I will say that I've seen it used in conventional healthcare in regards to people who get facial injections for fillers and different products. Often those providers will have that person take arnica ahead of time to limit the bruising because the face can bruise so easily. I used it myself and my children for different bruises that they would have, and it would clear their bruises up so fast. So there's definitely benefit there. Magfoss is another one I used. There were little tablets by Highlands, and I had a daughter who was colicky. She was colicky for an extended period of time. And my husband came home from the Whole Foods store one day with Magfoss. And if you look at the bottle, it says it's for menstrual cramps. And I looked at him, and I'm like, you realize she's 6 months old. She doesn't have a period yet, right? And he said, no, the guy swore by it. So at this point, I was so frustrated. I looked at it. I didn't see anything that could cause harm to her. They're little tablets, so they dissolved right in her cheek. And I put one in there, and within 5 minutes, her colic was gone. And I used that repetitively for the rest. And as soon as it would start at that 4:30 in the evening, I put that tablet in, and it would go away. And it was like a godsend, seriously. I made that recommendation in my practice, given that same story I've just shared with you, to other patients who came in with children who had colic, and they brought back that same information back to me, that it was incredibly effective. So it's magnesium phosphate. It has other ingredients, but it was amazing for the care of that. And then Comforte, this is the one that I highly recommend for anxiety and sleep. I still recommend it. It's easy to have on your night table at your bedside, to pop a tablet or two into your mouth and let it dissolve. You don't need water for it. And it doesn't sedate you. It doesn't have any of those effects, but it just seems to calm the central nervous system. I more recently recommended it to a cousin of mine who was experiencing anxiety. And she had gone through the gamut on everything else. Nothing was working. So I told her, and she brought this in, and she said within the first time of using it, 2 tablets, she just felt complete relief. So although it may not have scientific proof and they can't back it up, there has to be something there, because I've seen it work over and over again. And when it comes to safety, a lot of the products are highly diluted. Some products are sold or labeled as homeopathic, may not be. You really just have to watch your messaging. Highlands is a brand I've used successfully for a very long time, and have had good results with it. Although they themselves also had their issue, as they had teething tablets back in 2015 or 2017 that had belladonna in it. And, some of the tablets were considered to have too much belladonna in it, which we know is a deadly nightshade. There were no long-term effects of the children who received it, but it was considered a problem when they measured it. So that was taken off the market. Interestingly enough, that was after I used it with my children with teething, and they did okay with it. So, you have to be careful with it, because sometimes people have no negative side effects with it. And if it's not monitored carefully and they have more of the active ingredient than what should be given in it, you have to just be careful. So just know that it's not evaluated for effectiveness and safety by the FDA. The last 2 alternative therapy options we're going to talk about is aromatherapy and Reiki. Aromatherapy is the use of essential oils from plants, and I've talked about this in complement of other alternative care and complement care so far, but these are usually flowers, herbs, or trees. The oils are often used by inhaling them or applying them in a diluted form to the skin. Many essential oils are used in aromatherapy, including those from Roman chamomile, geranium, lavender, tea tree, lemon, ginger, cedarwood, and bergamot are some of the most common ones. Benefits is that it's often used for insomnia. I always think of lavender for relaxation, and it helps for insomnia, but we don't know whether it's helpful because little rigorous research has been done on this topic. It is often incorporated into massage therapy, as I mentioned when talking about massage, and it can be used as into a lotion or an oil to help with knee pain, such as from osteoarthritis or pain. And some people with cancer will use it because the scent or the therapy just helps with their sense of nausea. One study of aromatherapy using 2 contrasting scents, such as lemon and lavender, and people under stress found that lemon had a positive effect on mood, but neither scent affected stress indicators, biochemical markers of the immune system changes, or pain control. So Reiki, it's a complementary healthcare approach in which practitioners place their hand lightly on or just above the person with the goal of directing energy to help facilitate a person's own healing response. It's based on an Eastern belief in an energy that supports the body's innate or natural healing abilities. It's been clearly shown to be effective for many health-related purposes, or it has not been clearly showing, for showing any health-related purpose. It's been studied for a variety of conditions, including pain, anxiety, and depression, but most of the research has not been of high quality, and the results have been inconsistent. And in essence, either of these have both have good safety comments with them. In regards to aromatherapy, the only worry or concern would be that of an allergic response to the scent or the plant used. And in Reiki, because it's such light touch massage or energy work, there's just literally no harm other than the potential for maybe discomfort in the position you're lying during it. So incredibly well received. And before you do any of the things we've just talked about, please make sure to talk with your healthcare provider. Always check before starting the complementary therapies. Never stop taking your conventional medicine or alter the dose without the knowledge and approval of your healthcare provider. And please don't be worried to talk about it with them. I'd like to think we're getting better and better at becoming more savvy with some of the other kinds of alternatives out there. And as I was saying at the beginning, before we even started recording, there's a lot of good ways to get it to a good end health result. And sometimes it takes more than just conventional medicine. Sometimes it takes complementary medicine, and sometimes it takes alternative medicine. So work with your people in that regard. And then in case we don't have a lot of time for questions or you're watching this later, this is my contact information. So please reach out and ask any questions. My reference list is also available. And that is it. I stand for any questions.
I don't see any questions in the chat. I don't know if anybody has any questions. I personally, when you were talking about omega-3s at the very beginning, I choose to not eat a lot of animal products. And so I've done a lot of research on vegan omega-3s and or any kind of supplements, being vegan or vegetarian. And the omega-3s, it keeps pointing back to like seaweeds. And so I don't know if you have any recommendations or experience, I guess, with those of us that choose to not eat animal products for some of those kind of supplements.
Absolutely. You are not unique.
I
So
knew
that's
that.
okay. Yep. No, there are many people who are vegan and or vegetarian. There's obviously a difference there in that title. Yes, omega-3s are omega-3s. Fish oil is one of the most common ways to see that garnered. Seaweed is another common place that you'll see it. You're just looking for the omega-3 fats is what you're looking for. So whenever you're looking at a product, you want to look on the back of that for that value. And then you want to find a product that has a good reputation standing behind it. And I will say health food stores are usually pretty good. And then usually the people who work in them are really knowledgeable about their products that they carry. Less likely, and I'm not going to throw any specific companies under the bus, but I would go to a health food store that has reputable people in it who can talk to you about the product if you're unsure. The chain stores, and I'll just leave it at chain stores, are not always your best choice on finding a reputable product.
Yeah, I go to a lot of stuff online and again, Google the research on that and, get the ones that are have the best reviews and the best successes.
Absolutely. Absolutely. They will all have feedback on them. And, look for the quality product labels, and if you've got, a commonly used standard process, it's a whole food based vitamin supplement company, and they do good work, but that's not the only one. There's tons of them out there that do great work. So find a company that you like, that has science behind it, that where they farm their products, where they bring their products in from, the facilities their products are put together in. And that's the product line to probably stick with no matter its name.
Mm-hmm. Mm-hmm. And one other question you mentioned for the anxiety, the homeopathic comforte. How do you
Comfort.
how do you spell that?
CALM
Oh,
and then
CALM.
FORTE.
Okay.
And the homeopathic company I have most commonly used and had good success is Hylands, HYLANDS. And they have that Comforte as tablets. They also have it as a drink mix or a juice for kids, but for adults, it's a tablet, and it's amazing. You'll get 240 tablets in a bottle. And I know they talk about safety, and I'm going to tell a funny story if we've got a minute. I have at the time, I had a 3 or 4 year old. I can't remember how old he was at the time. He liked the taste of the tablets we used, and we had them for his sister for teething. And his grandma was watching, my husband's mother, I always say, was watching him while my husband and I went hiking. And he got into the bathroom and got a hold of this bottle, and it was brand new. And he took all 240 tablets of that homeopathic medicine. And I came home and went into the room and saw all the powder on the floor, on the counter, and little tablets over here and there. But I went and asked my husband, I said, how many tablets were in that bottle of, I think it was Comforte, might have been Magfoss. I can't remember at this time, but it was one of those two. I think it was Comforte. And he goes, it was brand new. I just bought it the other day. I'm like, it's empty. So as a parent for a child who's just taken almost 240 tablets of a medicine, no matter what it comes from, I was like, oh my gosh. So I went to Google, because we always do that. I'm going to say it. We all look at things. I was less familiar with homeopathy at that time. I looked it up, and I found that because of the micro amounts in it, even though those small amounts are still incredibly effective, that if you take too much, that the most effective, the thing that will happen is it will have the parallel effect of what it's supposed to do. So instead of him being calm, I could barely pull him off the ceiling for the remainder of the day. But it did not require a trip to the emergency room. It did not require me having to go to using charcoal or calling the poison control center. Mm-hmm. He just, so safety, it's there, but that was a relatively mild homeopathic to begin with. The one that had belladonna, had he overdosed on that, that would be a different story. So you have to put it in the realm of the active ingredients, but just know that it's pretty safe. And when people say, oh my gosh, I took 6 tablets instead of 4, I'm like, yeah, you're okay. I got a better story than that one.
Wow. Yeah, no, I've used some, not that one in particular, but some other ones. And I sprained both my feet and used arnica, went through a whole tube of arnica, and it was like it helped in my healing.
I have had patients who've tried everything and then they've tried arnica and they're like, what is in that magic gel? I'm like, it's not magic. It's a unique way of looking at it. As I talked about in those two theories, it's like and minuscule amounts having the greatest effect. I mean, it's kind of neat that way.
Hmm. Yeah, great presentation. Does anybody else have any questions? You can just go ahead and chime in or add your question to the chat.
Thank you,
Saying
Tracy.
And it will be on YouTube, up on YouTube in a few days. If anybody wants to watch it again, I know I will.
It was a
It's
lot of information.
a lot of information, and it was great. I mean, I go to a lot of this stuff that you. The other thing that is diet too. I know diet's huge on this also.
And I would have put that in there as another, but it, with an hour talking as much as I had
Yeah.
it, I couldn't get through diet. But I would tell people the best resource for this is National Center. I'll put this in the chat bar. Let me see if I can put this in the chat. The National Center for Complementary and Integrative Health is phenomenal for where you can go get information on anything that I haven't even talked about. But this is amazing. This is one of my best resources for this presentation.
Great. I know this could probably last for 3 hours.
Oh, yes, I could have done some big deep dives and that just wasn't
Yeah.
possible.
The information was wonderful, and we thank you for all your time and your research in presenting this to us. So
Thank you.
yeah,
My
thank
pleasure.
you.
Thank you for having me.
Michelle, anybody last questions or
This is Sheena. Just thank you so much. And I should be able to get it up on YouTube here later on today. It should come pretty quickly, I think.
awesome.
Great.
All right.
Thank you. Shayna, if you can send me that link, I would appreciate it.
Okay, will do. Okay,
Okay.
thanks everybody.
Thank you, everybody, for coming.
Thank you, Michelle, and thank you, everybody. Have a great day. Bye.